As the demand for hair transplants grows, many are drawn by the allure of low-cost clinics. Unfortunately, while the savings may seem appealing, they often come at the expense of quality and expertise, increasing the likelihood of botched results. Let's explore the common problems that we see from these procedures, and most importantly, how to fix them when things go wrong. Let's start with a conversation about scarring. Poor scarring can occur in the donor area or the recipient area. In the donor area, we have to talk about FUT and FUE separately. When you have an FUT scar, there are a few options to potentially improve that scarring. The first of which is to cut out the old FUT scar and resuture it with better technique under less tension. That can sometimes give you a nicer looking scar. Another option is to use FUE technique to place grafts along the FUT scar. That can be a nice way of masking that scar, but also bringing some fresh blood supply to the scar. And as we do that, the actual scar starts to remodel and starts to look more healthy. It doesn't mean that the scar will completely go away, but it does tend to soften it as you bring that fresh blood supply into that scar. And there's also the option of scalp micropigmentation, which means depositing small amounts of ink in a dot-like fashion along the scar to give the illusion of actual hairs in that scar. Just like hair transplant surgery can be done in a very artistic way, so too SMP has artistic elements to it, like the variety of dots that are placed, how dense they're placed, and the ability to place them in a way so it doesn't smudge and change colors. All of that is important for SMP done right. And I have a video from a few years ago on SMP if you want to check that out. And when we have donor scars that are from FUE harvesting, the options are somewhat similar. We usually don't remove surgically each of those small little circles of scar and resuture that. That would be rare, but we can offer some additional grafting with FUE technique from other areas to bring some grafts into those small dot-like scars. And that hair is sometimes taken from other parts of the scalp, but it can also be taken from, let's say, the neck if someone has a good supply of neck hair, and that usually works quite well for FUE scars that are bothersome to the person. You can also use SMP as a way of non-surgically reducing the appearance of those FUE scars. And at the recipient area, to have visible scarring usually is because there was, let's say, an infection that occurred after the original surgery, or for example, if too many grafts are placed into too small of an area, or so many sites are made that it compromises the blood flow to the area, then you could have a situation of developing necrosis, and that usually, once it heals up, it leaves a scarred region. So to address that, you can sometimes surgically remove that area of scar, but typically that's not the most practical approach. Usually the most practical approach is to bring in a fresh supply of grafts in a secondary procedure to reduce the appearance of that scar tissue in the recipient area, and to optimize the overall appearance of one's hair in that zone as well. Of course, SMP can also be used, but if we're talking about the hairline, it might not be the best place for SMP. Instead, bringing in a fresh supply of grafts might be the best approach. Another issue with botched procedures is an overharvested donor area. When there's limited scalp donor hair to do what needs to be done at a recipient area, you have to consider other sources of hair. And that sometimes will be body hair transplants, where you're taking hair from areas other than on the scalp to bring them into a recipient area on the scalp, because essentially you've run out of donor supply on the scalp from, let's say, a single procedure or sometimes several procedures that just overexhausts the donor area. The next best place to get hair when it's available is from the beard. Some people do beard hair transplants as a donor and take from the actual face. There's always a risk of scarring, so I tend to avoid harvesting from the face itself. Even with small punches, it's still possible to have it be more obvious where there are scars. Instead, I like to stay below the level of the mandible to do some harvesting from the neck if someone has a good supply, and if additional grafting is needed somewhere on the scalp. There's also, of course, the potential to harvest from other areas like the chest, the back. Some people even, go into the abdomen or other areas, or arms or legs. But the issue with these other areas is that they're less likely to be in the anagen phase of the hair growth cycle. And what the studies have shown is that over time, when you track the progress of someone who's had body hair transplant, let's say from like the chest, the hair doesn't tend to grow well over the course of many years. So you might get some initial positive impact and some decent growth, but how it will fare over the course of 5, 10, 15 years from the studies that we're seeing coming out is that it doesn't tend to do all that well on the scalp. So I try to avoid harvesting from those areas, and I just stick to scalp and neck when it's needed. And so it's not that you can't get hair from other areas, but you have to consider how it will look many years from now. And will it be worth it to get scarring in those other donor zones in order to bring some fresh hair in that may not even last on the scalp a decade from now. So my estimation, usually it's not worth it to take from anywhere other than the scalp and the neck, even if it's technically feasible to. You also have to consider that the scarring that you get from, let's say, FUE surgery in areas other than the scalp and neck is going to look a bit worse because the blood supply is not as rich as it is in the head and neck area. So the actual dot scars heal a little bit worse, and they're a little bit more white and more obvious. And that's something that isn't often talked about, but I think is a really important consideration when you're considering body hair transplant surgery. The next item worth discussing when it comes to botched hair transplants is when there are poor hair directions and angles that are used, and also when the hairline is placed too low. There are a few options for these types of problems, the first of which is to remove some of these poorly placed grafts with FUE extraction. The disadvantage of this technique is, of course, that you're going to leave these little tiny dot scars. So when it's right at the hairline, it can be a bit problematic because now you've given someone small little white scars that might be hard to hide. And that is the biggest disadvantage of doing the FUE extraction right there, let's say at the hairline. The advantage of the FUE extraction is that you can take that graft and utilize it in a more natural way, let's say further up higher on the hairline or just in a different location. So you can actually use that hair and it doesn't go to waste. There's also the possibility of laser hair removal. So if the hairline was dropped too low and you overall have a decent donor area and you don't mind getting rid of some of that hair, sometimes the best thing is just to laser hair remove it so that you can start fresh and you don't then have all these little scars from FUE extraction. So that's something that I bring up with some patients for repair cases, and while we don't offer it in my practice, most med spas and dermatology offices will have some of this laser hair removal capability, so I encourage people to sometimes get that done, and that will take a few sessions before they come in for me to then design the hairline from scratch in a more natural way. Now, the other option when you have a bunch of grafts that are sitting at poor angles and directions is to bring in a fresh supply of FUE grafts and basically work between those poorly placed grafts to create a more natural look. The problem is when you have some of the original hairs that are going in one direction and then you have these poorly placed grafts from another clinic where the directionality it does not match what's naturally there. When I'm doing the repair case, it's like you have to decide, are you going to more follow the original direction angles or the poorly transplanted grafts, Or are you going to do some sort of a combination between the two and basically average the two out and say, well, if the original hair is at a 30-degree angle and the transplanted hair is at a 90-degree angle, do I go somewhere in between for the way that I create the actual transplant repair, right? And that is like a case-by-case type of situation, but that's always an interesting question of, which do you follow? My usual approach is to follow the most dominant hair population, right? So if it's mostly transplanted hair that's in the zone and there really isn't much of the original hairs left, then I'll try to mimic what has been done with the prior transplants. Unless, it's a really big problem and we rather remove some hair through the methods I already described with FUE extraction or laser hair removal. But if it's something that's salvageable, sometimes just adding more grafts that are mimicking what was there already, the dominant population, that will still allow for an overall fairly natural look. It might be a departure from what the person originally had, but it's basically going to be their new type of look, right? So those are the options when it comes to dealing with misplaced and poorly positioned grafts. Another issue that I see with some hair transplants is that there's a poor distribution pattern. Sometimes it just appears too regular at the hairline or in areas further back. For example, you may have seen some transplants that are done where the grafts are placed in these perfect rows. Hair does not exist naturally in that way. So when I'm doing a hair transplant and creating my sites, there's always this staggered type of pattern. There's always some built-in irregularity, and that's what creates in part the natural result, right? So if you have too many of these rows and too many hairs looking like they're perfectly placed, that can start to look a bit artificial. So usually the way that I correct that problem when someone comes to me with these very, regular types of rows is that I increase irregularity by adding more grafts. In between what was already placed by the previous clinic, I'm basically going back in with more grafts and bumping up that irregularity so that it looks more real. Another area where the overall distribution of grafts can be a bit odd is at the crown. There are two general problems here. One is sometimes people don't follow the actual whorl. There's always a whorl that exists in the crown, so making sure to recreate that whorl is important, and if it's not done, things can look a bit odd and fake, right? And also another issue is that some people oversaturate the very epicenter of the crown and they forget to basically blend in with the area surrounding the crown that is more full. So you can get something called the halo effect, where you have this very strong center of the crown and then you have this thinning area around it looking like a halo. So the way to correct that is to add more grafts into that thinned halo region. Of course, the best approach is really not to have that problem in the first place, but if it's there, that would be the way to adjust for it. And the other issue with the center of the whorl is that if the angles are placed too flat, that can reduce the actual coverage or the appearance of density in the area. The natural exit angles of the center of the whorl are quite perpendicular, and that exists in nature not by accident. The purpose of it is to provide more coverage because you have a very curved surface, and by having this kind of perpendicular exit angle, you're able to cover more territory. And that is what everyone has at the center of their whorl. So the transplant needs to recreate that angulation, and if it's not done, then it can look rather odd. And the correction that would have to be made would be to put more grafts into the center of the whorl that are at this perpendicular type of exit angle. Another problem that we sometimes see is that the hairline can look too straight, and it has sometimes this kind of wall-like appearance. It can just look too heavy in some cases. And we saw that recently with Chris Bumstead's example, and we have a video on his case if you want to check it out. But essentially the way to adjust for something like that would be to increase the irregularity and to also add single hair grafts. That's really the key when it comes to making the hairline itself, those first few rows, look more real, is to add single hair grafts. But remember, when you're doing an FUE harvest, there really aren't that many single hair grafts that come off naturally from the donor region. So in order to create the single hair grafts that you're going to place right at the hairline, you have to split hairs literally under the microscope. So that's taking like a 2-hair graft or a 3-hair graft or even a 4-hair graft and splitting it into these single hair grafts. If a clinic doesn't do that, well, things are not going to look as natural right at the hairline. That's a critical, extremely important step to get natural looking results at the hairline. So when someone comes into my clinic and they have all of these heavy like 2 and 3 and 4 hair grafts right in the front, right in those first few rows, the answer for how do I get my hairline to look more natural is at a minimum going to be adding a lot more single hair grafts to the area and increasing the irregularity, sometimes removing some of these grafts in order for things to look much better. Now let's get into some general advice when it comes to dealing with these repair cases or these botched types of hair transplants. The first is to be patient with the regrowth and not to rush into doing the repair. Sometimes I get these messages like 3 days after someone has had a hair transplant elsewhere, and they want to know, what do you think about the way that things were done? And, or I'm not happy with it. Can you repair it? And that is like way too soon, right? To consider a repair. Even 3 months, 6 months, all of that is just too early. It takes time for hair to grow, and it's important for the inflammation to settle down and for us to see the final result of the initial procedure before we start planning for another one. And usually that takes at least 1 year. And I'd like to pause and add here that if a result just looks like there's lower density than what you would have liked, but assuming that you didn't have any, complications after surgery and that overall the directionality and angulation was done properly and your donor area still looks good, that is not a botched result. That is a fairly standard thing that happens with hair transplants where people just want more grafts. Of course, you don't want a situation where it's way too sparse, but sometimes people look at lower density than they would have liked and they think, oh my God, I was botched, they didn't do enough. If that is the worst problem that you have, that you just need a little bit more as far as grafts, consider that a non-problem and really just something that should be, I think, viewed positively that, hey, things were overall done well. We're just going to go back in and bump up the density to the area, assuming you have donor supply still remaining, assuming you overall healed well. That is not botched surgery. That is just an opportunity that you have with hopefully, the same team to improve things even more. That is a big distinction from a botch type of result where you need to consider repair strategies and corrective techniques. It's a very different type of case than just going in and adding some more grafts. And what I recommend to my patients is that they at least have a good conversation with their original treating clinic and specifically their treating surgeon to see if they're not completely satisfied with the result, what can be done. Usually clinics want you to be happy, right? That's it's good for business, it's good for patient care, and you probably did your homework in the first place to pick a clinic, to pick a surgeon that you trust. It's always best to go back to them to at least have a conversation, give them a chance to help you, to make things even better, and allow them to guide you a bit before you start seeking a million second opinions. But there does come a point where if you feel like there is a mismatch of what they originally told you and what outcome you received, or you're not completely excited about their plan for you for the next procedure, sure, seek out second opinions. But again, I would encourage people to really stay open-minded and try to work with your original clinic to see how things can be improved, because there's usually heavy incentive for the clinic to overall make you happy. And then when you do seek out a second opinion, if you hear something that sounds very similar to what your first clinic told you, then I think you need to reconsider maybe how you're viewing a scenario, and really see if what maybe you thought originally would happen wasn't the most realistic thing. So sometimes you have to kind of look introspectively to really see what the next steps should be. But if multiple surgeons are telling you the same thing, there's probably a good reason for that. And when you do seek out second opinions, be careful with the clinics that are very quick to criticize the original clinic, right? Because it's very easy for someone to come in and for me to say, oh yeah, your first place was horrible, this is terrible work, I can do it better. But that usually just isn't the best approach, just from a collegial perspective. And the truth is that most people who come to me for a procedure where they were somewhere else for their first procedure or a second procedure, it's not that the original work was done poorly. Usually when I take on someone who had work done elsewhere, it's not that it was really bad work, it was just that, maybe the person moved, or maybe they're just looking for a slightly different perspective or a different artistic vision. So it's important, I think, for us to show respect to our colleagues and not be quick to criticize, unless I see, something completely egregious that was done. And then sure, I'll tell the patient, look, I really wouldn't have done it this way for these specific reasons, and I'm happy to help you. But I'm very careful not to, bash a colleague who probably had, best intentions in mind. So be careful of the places that, basically are using sort of marketing tactics that, in my opinion, are a little bit dirty. If someone's coming in looking for a second opinion and they're just bashing all these other places, I don't think that's a clinic that you're going to want to, be at. I think you want someone who's like level-headed, understands that, like, sometimes people are looking just for a different, set of eyes on their case, and that's okay. But we shouldn't be so quick to degrade someone else's work. And look, we can't please everybody, right? So there are times when a patient comes to me, a year after surgery, and they're not completely pleased, for whatever reason. But we work with them very closely to try to find a solution. And I would say that 9.5 times out of 10, when I have someone who's reporting any type of, complaint, feedback, anything that can be construed as slightly negative, we work with them to try to make things better and to try to make things right by them. And I think most clinics would be interested in doing that for their patients. And so I think if a clinic is trying to find a solution rather than, deflecting blame and, acting like, the patient's so, completely the problem, I think that's a sign of a good, reputable clinic that you can trust and that you should try to work with. And my general advice, for patients on this, and patients going to any clinic, is to try to be respectful towards the clinic. I think clinics are much more willing to work with you if you're not screaming at everyone and writing nasty emails and text messages, but really just trying to be respectful, hoping to get the same respect back from, of course, the place that you trusted. All of that should line up. Because I know that in my clinic, we're always looking to make patients happy, right? That's the whole goal of what we do. I call this, happy surgery, right? So if we have someone who's unhappy, and sometimes they're unhappy just for many other reasons, unrelated to our actual work, but people, listen, some people have real problems in their life, right? So they can be unhappy even before surgery, just as their MO. And we still, try to, do our job professionally, do it well. But when we have the occasional person who comes in hot and they really want to tell us, what bothers them, it's always better to bring that temperature down. And I'm saying this from a patient's perspective. I think you'll find that people will be more willing and likely to do things for you when everything is coming from a kind, respectful place, rather than a, fingers pointing and a place of blame. Just kind of general advice for patients, and also for clinics and doctors out there. I think in general there should just be mutual respect between doctor, patient, clinic, patient. I mean, that is just so so important and vital to doing this type of work. I also would like to stress how important proper aftercare is after hair transplants. Not just having like the instructions on what you should do afterwards, and we have like a video on YouTube that we send patients on post-op care that we'll put here on the bottom. Every clinic has their own instructions, and that's good, and that's fine. But making sure that you have good access to the clinic, to the doctor to ask questions, because some people read something on the paper and they still don't really understand what it means. Like, do you want me to pour the water this way or that way? And so I think having an open line of communication, is super important. Patients at this stage, get my cell phone number after surgery so they can reach me anytime. And I think that's really, really important, especially if, let's say there's an early infection and it's brewing, and, if you can catch it early, if you can catch some folliculitis early, that's always going to lead to a better overall final outcome than just letting things linger and then having to deal with bigger issues later on. So having the right aftercare, making sure you're really watching after your grafts in the best way possible after surgery is just so important. It's also important for just peace of mind, for the patient, and also for me. I know that if there's an issue, patient's going to let me know. That this way I can sleep well at night, knowing that they're doing okay if they're not, reaching out to me generally. So yeah, I think patients, deserve that type of access, and I think it's really, really critical for good overall outcomes. I also want to point out how important it is to be on the proper medical therapy when you're considering a hair transplant. And mainly when I talk about medical therapy, I know there's lots of things that potentially, fall under that umbrella, but I'm mainly talking about, for men, finasteride or dutasteride to truly prevent further hair loss. Because just relying on a hair transplant will usually not look completely natural if your hair loss progresses and you lose a lot more of your hair, because there's rarely enough in the classic donor areas to replace everything that you've lost in the DHT sensitive zones. And with FUE surgery, some percentage of what we take from the classic donor area is going to be DHT sensitive, some percentage of it, right? You don't know the full height of someone's horseshoe, when they're much older, if you're doing surgeries, earlier in life. And so that I think is something that people often forget. So some percentage of the transplanted hair could be susceptible to loss. And so with these medications, finasteride, dutasteride, you're essentially protecting that hair as well as your pre-existing hair in the classic DHT sensitive zones. And many patients have been going to feelconfident.com for their finasteride. And that has been a great service for people because, we bring the prices down as low as possible, usually beating out, the competition as far as pricing. These are generic medications, so there's nothing fancy about them. But offering them at affordable prices with these medications being delivered right to your door has really helped a lot of people, and they've enjoyed the service. So we've gotten great feedback on that. And we have, many thousands and thousands now of patients who are receiving these medications, every year from Feel Confident. So in addition to, our hair care sets like the shampoo, the conditioner, thickening foam, we're working on our own scalp serum right now. In addition to all that, there's of course the tried and true finasteride available as a pill and as a topical. But as I often say in my videos, it's better to start off with like the classic 1 milligram a day oral dose. And if you have a side effect, then we can always dose reduce. But that's my general recommendation when it comes to preventing further hair loss in most men. I also want to touch on the psychological impact of botched hair transplants. Because, people go into these surgeries wanting to obviously look better. And there's this recovery period that's tough on everyone, until the transplanted hair eventually starts to grow. But then when the growth is problematic when, angles, directions are off, when you have these heavy grafts right at the hairline, when the hairline has been placed, too low. Things just look rather fake, and then people can get very upset and in many cases depressed. So I think it's very important to think about that and to do the proper planning, to really pick the place that you're going to for your transplant, pick your surgeon wisely, and not just choose, some low budget place, regardless of the country that you go to, but choose quality. This is your hair. This is something that's permanent. You have limited donor supply. You can't just keep redoing it a million times, right? You'll run out of grafts. So where you go for your first hair transplant really matters. You want to end up in a happier place after surgery. You don't want to be in a worse off place than where you were before the surgery, right? So I think that's really, really critical to think about and to discuss.